I have to contain.
The honor and privilege to have a conversation with these amazing Black women leaders in HHS. So, as we talk about wrapping up, I want to ask you, when you think about takeaway messages and talking about everything we've heard this week, what is your takeaway as we think about building on the work that we do and what we need to do for the future on our programs?
I think one of the takeaways are that we have to see healthcare in the much broader context. Black women are beautifully complicated. And when we think of Black women, we need to make sure that they can bring their whole authentic selves to clinical medicine, public health practice, epidemiology, surveillance, program. People who know me at DHP know that if you are going to present the disparities that exist, it's so important that you present the narrative, the longstanding social inequities for why those disparities exist. And as I said previously, please do not send me anything that says that Black women are hard to reach. We are here, we are in the light. We have to be creative and innovative and find Black women where they are and where they want to be met.
Great, nicely said. Now, Yemisi, come on, lead into that as well.
I love what Robyn said. The other key component is ensuring that Black women are at the table, both sides of the table. And as far as the workforce goes, it was so encouraging to see a panel full of Black women in federal government. So we're a part of those conversations. We want to continuously be a part of the conversation. And I think USCHA was an opportunity for us to see a vast representation of the people that we're serving. I can't express that enough. From the people who were dialed up on their first day, in their Sunday's best, to people presenting at the conference and asking questions. Everybody just seems like we're a part of it, and we want to stay here. We don't want to leave.
That's right. Now, Mary, I know you're not shy. So I'm going to ask Mary to fill in and tell me about from that SAMHSA perspective and what you've heard this week and how we discussed on the panel.
There is no health without mental health, right? And so, as my colleagues have just shared with you, we have to have a holistic perspective to taking care of people to stop it before it starts. Prevention will be key as we move forward. The other thing I want to tag along on that you brought up about don't say that Black women are hard to reach. Absolutely not. We're not hard to reach. I don't like underserved either. I don't like underprivileged either. It's under resources. If we had the resources and the access to care as our counterparts, then we would not be underserved. So that's what I would like to add to this. You all have done a phenomenal job this week as well. Back over to you, Kaye.
I told you she wasn't shy. So, from takeaways, we all go back to our agencies and we all continue to do the work. And one thing I heard time and time again, we put our whole selves in this work. We continue to do so. And we stand on the shoulders of some wonderful, amazing Black women leaders in HHS. But what's our message to our young Black women leaders that we want to usher them right in to work side by side with us and make sure that when the time comes, that we have a baton to a hand that's ready. So what do we need to do with that?
I think it's so important to continue to support our young visionaries and icons who are coming behind us. We all stand on the shoulders of so many beautiful Black women who have opened the door for all of us. So I think it's important that when we're at the table, we are always reaching back and making sure that our sisters are coming to the table as well. And it's not enough just to pull up a seat at the table. We need to ensure that their voices are heard and listened to. We know ourselves, we know what we need. So when we are in those rooms as leaders, we need to ensure that our fellow sisters are there and are getting the respect that they deserve.
I think about what you said and pulling back and bringing them to the table. I think at our agency, HRSA, I am fortunate enough to work with a lot of people who look like me. And it's important to reach out, but it's important to be open enough to be coached, mentored, and brought along. It's not enough to just say, hey girl, how you doing? You made it. There's a nurturing that's needed for people who look like us so that we can be a part of those conversations and make impact in everything that we do. It's not just about being there and showing up, but having a contribution, being mentored, being coached, being nurtured by people who look like you because they've been there and they're currently there. I see you ladies and I look at you not only as peers, but as mentors. There's a lot I can learn from you and I can take back to my agency. I'm really big on mentorship. So I think continuing to hold people's hand and take them along is key for me.
Center of excellence. We got to get them as soon as they come out of their mamas. That's where we got to start. From kindergarten straight through PhD, MD. And unfortunately, because they are beautiful Black women, they'll probably need both. And so it is our job to show them that you can do it. You will do it. You have to do it. It's bigger than you. It's not even about you. It's about all the other people that we can impact and make sure our Latina sisters, our Asian American sisters, like we can be the gold standard for everybody else to get to where they need to get to and open up doors that were closed. They are now open. Back over to you, Kaye.
Thank you. As I talked earlier, I said all we need is a little respect. All right. And that's love and respect in the work we do because we put our whole selves in this work. As we kind of wrap up this discussion, I want to think about one word, okay, maybe two words, as we move forward to do this work because we've got lots of work to do. And it was heartfelt to me. I had so many women come up after our panel and say, this is the first time they've ever seen a panel like ours. And I was like blown away by that. But since we've had this panel, we can keep this momentum going.
I think what's been so beautiful this week and what I hope we all take forward with us, you don't have to change. You don't have to code switch. You can show up as your authentic self with your braids, your kinky hair, however it is, into the space. And as you said, Kaye, be respected. Sometimes we're going to have to demand that respect, but please know that you can show up as your authentic, whole self with no apologies.
I think the two words for me is Black excellence in everything that we do, not just in our attire and our beat face and our fabulous hair, but in the work that we do. Making sure that everything we put out is excellent, making sure that there's no doubt when they read a report that it came from a wonderful Black woman because we've dotted all our I's, we've crossed all our T's. And when we do that, respect comes automatically. And if it doesn't, we might just have to take it. But at least we put our best foot forward. Black excellence.
Amen. 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 Systemic. I think from a systemic level, we have to make sure people know that we are at the table. We are the table. I think the level of respect. We got to get rid of the isms, the sexism, the discrimination, the racism, the agenda. We got to get rid of the isms. And as soon as we do that, then guess what? Then we will be enforcing DEIA, diversity, equity, inclusion, and accessibility. Thank you.
With that, I just want to say I'm honored to be with these fabulous women. This has been so emotional and fulfilling. And for me, it's like I know who to call because we've got work to do. And I trust these sisters because trust is so important.
It is.
So with that, thank you for listening to us and we'll see you soon.